I've found that in patients who have a lot of skin issues and pain, really taking apart their gut health. That's something that you'll see a lot of patients who have had acne or if they've had other skin issues, and they really do a great job of fixing their diet and improving their gut health, and their skin conditions can subside. Versus going at it from maybe retinoid creams and a lot of the more harsher chemicals to try to manage.
Inflammatory osteoarthritis. The participants consumed 10.5 ounces of Tart cherry juice twice a day for 21 days, and they've noticed significant reductions in almost all the inflammatory biomarkers and also C-reactive protein levels.
Excellent.
Welcome to the Functional Code, your go-to source for decoding optimal health. Join Dr. Addy and Dr. Jace as they break down the science behind pain, performance, longevity, and more, making complex concepts easy for you to understand and apply in your life. Your journey to a healthier you begins with understanding the Functional Code.
Welcome back, everybody, to the Functional Code. We are excited to bring to you guys today a new podcast. We're going to be talking about arthritis, understanding arthritis. There is a lot of arthritis conditions out there. We need to know, do you have it? Is it just something you get from your parents? How do you manage it? Is it a death sentence? Should you be worried about it? What are all the other things that come with it? So we're going to be talking about all of that today on the pod. As always, I am Dr. Addy.
And I am Dr. Jason. Right before this, we found out that there's over 100 different types of arthritis.
Yes.
And quite frankly,
We didn't believe it.
Is ChatGPT still going on?
I think it's still going on the list. Yes. It is an extensive list. And I couldn't believe that there are that many types of arthritis. Mm-hmm. And I do think it comes to the point now where if you live long enough on this earth, you might get, you're going to be dealt one form of it, whether you like it or not. That's just how we age as humans. But we're going to be talking about all the different types, the ones that are the more common types, obviously, how to treat them, what things to think about when choosing treatments for them, what works the best. We're going to dive through the research and show what you should maybe think about doing first and avoiding versus what does maybe work as good compared to the research. And then, we're going to really hit all the major points on how to really make this improved in your life and stop having this issue of feeling that arthritis is controlling your life. Because a lot of people really do feel like, oh, it's just my arthritis acting up. And I have to, and it is. It's come to that point where I think a lot of people just think that's going to be what continues to drive their pain and not improve at all, and that's just not true. You can avoid a lot of limitations and pain with arthritis. There's not a lot of things that you should be really worried about when it comes to arthritis, unless it's some very rare, severe form of arthritis that it tends to happen. But other than that, most are manageable and can be improved.
Absolutely. So, let's start off with the main one, which if anyone hears arthritis, this is usually the one that most people thinks of. It's known as osteoarthritis. This is usually where there's wear and tear of more on the cartilage, and can be whether it's from overactive activities, same repetitive movements over and over again, like construction workers, workers that are just in certain positions for longer periods of time. More or less, with this type of arthritis, especially for sedentary individuals, your body will adapt to certain positions against gravity for not only the tissues but also the bone structure. So let's say, for example, for scoliosis patients that have like curvature of the spine, over time due to gravity, the bones will start laying down. The osteoblasts will increase bone formation, lay down bone spurs, and the bones will then connect or break down the discs or nearby structures from there. So that's usually where we see this a lot in the spine, the hips, the knees especially, but it can be most any other places throughout the body, but those are the main ones that we see as well. So like age is one thing, but that's more depending on how mobile that individual is. Like we've seen individuals in their late 80s, early 90s with little to no arthritis or degeneration. And those are the individuals that adopted a movement practice that are staying consistent, especially like Eastern medicine, like Tai Chi, yoga, those different types of fluid
I feel like those patients too, they manage their weight well.
Very well.
So that can be a huge driver, unfortunately, as well.
Yeah, good point. And then especially some of the stuff, there is part genetic component. I think my 2 cents on that is, from my perspective, is the children will follow the tendencies, the habits of the adults, and that's usually where there's a potential genetic component.
Is it culture, environment, or is it genetics?
Yes.
Can be easily argued that if so-and-so has it, kid has it, it's genetic. Was it just a learned habit, not so much an actual genetic expression?
Lifestyles, all that.
Now, in certain cases, yes, there are those risk factors, but more often than not, you can manage this very well and not be sentenced to having this if you feel like that's what's going to be dealt to you because your parents have it. But if you treat yourself well, if you move, train, eat well, you can move away from any genetic expression that you were given. It's just a matter of consistency and discipline.
Oh, absolutely. Stated on that. And we know now with research that movement exercise will help not only for the pain that can come from arthritis or more from the tissues surrounding the area that's undergoing degeneration or osteoarthritis. I guess I have a study there, but it's the more important part is getting movement. So let's break down a couple, like one main specific one, especially degenerative disc disease. And this is in the same ballpark with osteoarthritis. So when you start noticing bones that are starting to create bone spurs on the either front, back side, it doesn't matter too much. Usually comes with wear and tear on the discs and or for the knees, the meniscus, or the hips, the cartilage in the hips. Either or, it's more or less a protective mechanism. But when that happens, we start noticing compression on the nerves just due to pressure against gravity. And that's where either a couple things can happen, either disc issues, it could be instability, but that can lead to a bunch of array of problems. Now we know that we can actually reverse the aging process of the disc specifically because there is vascular input around the outside portion of the disc. So if you go through specifically workspaces, you go through the biggest range of motion, both directions, they'll create a pumping action, not only for the spine, but also for any of the large major joints, to where we've actually increased the disc height for certain individuals quite well with that side. So that's just one thing I wanted to point in there. If you notice that your discs are breaking down due to this condition, that's movement throughout the fullest range of motion in a progressive manner, loading it will also help really well. There's other specifics with that, but I suggest go back to other podcasts on those.
Absolutely.
From there.
Yeah, and a lot of the times I think one of the most studied conditions is knee osteoarthritis. It's by far one of the more common treatments that are pushed for products and things to improve your life and those kinds of things. And I bet you could look up 100 different studies on each different condition. And so what I did was I put together this, well, actually I didn't, someone else did, put together a really great review on all the treatments for knee osteoarthritis and what can you do, what should you do, things should you choose to do versus others, versus different efficiencies and those kinds of things. So
this is an awesome list.
I'm going to go through most of these, not all of them. You really just take apart the more common ones and then the things that actually show some good change with patients who have knee osteoarthritis. So with knee osteoarthritis, a lot of patients like to use topical anti-inflammatories. It says that it is effective. However, there's risks to NSAIDs. And yes, you can use it as a first line for pain management, but overuse, you're going to have issues long term. So it's something you need to think about. The next on the list was capsaicin cream, which actually showed moderate pain relief. You're going to have some burning sensation when using it, but when you used with other types of therapies like PT and things like that, it can be very helpful. Next would be acetaminophen. It actually showed limited efficacy, which I was surprised to hear that. Not only is it not really efficient, if you use it long term, there's a risk of liver toxicity. They say you should really not even use it short term. I would have used something else in place of that. Again, oral NSAIDs, same thing, can be effective. You got to have risks long term. Opioids, last resort, high risks of addiction and even death. They said only when other treatments fail. I would disagree. I wouldn't use opioids at all for pain management, just because the risk versus the reward is not there. Corticosteroids, short-term relief. However, use of corticosteroids can possibly degenerate cartilage and other tissues in the body. It can delay healing. We talked about how it can possibly delay the healing of a disc issue if you're using it for herniated disc. We've talked about corticosteroids on our podcasts a lot. Short-term use only. I would even argue trying to find something else in place of corticosteroids if you haven't used anything yet. Next are HA injections. Generally safe. I've used these a lot in clinic. I don't see a lot of benefit with them. In research, they say there's modified benefit.
And that's for the knee.
For the knee, yep.
Yeah.
It's a good alternative for those who want to avoid NSAIDs, what they showed. I can move on to some other injections that are more experimental, but I don't want this podcast to have censorship. We have definitely put out other podcasts on these types of injections.
Yes.
Botulinum toxin, I don't know why anyone would inject that in their knee. I would not even recommend it.
No.
Metformin can have some anti-inflammatory effects. I wouldn't use it first line for knee osteoarthritis. I think most patients that are overweight and have diabetes that are taking it are seeing pain relief, and I think that's why they're studying it. But I wouldn't use it as first line. Statins may slow OA progression. Again, the side effect profile of statins, we've had guests talk about this before on our podcast. I don't think that's something that you should rely on for not only your knee OA progression, but your cholesterol management. Curcumin or turmeric actually showed limited efficacy. There's still some bioavailability concerns. This is just for knee OA now. Boswellia, again, weak evidence. Glucosamine, mixed results. Fish oils, unclear benefits. Heat therapy, short-term relief was showed. There's no real risk to heat therapy, so that's something you should try. I love heat ice, that's all great. TENS machine showed inconsistent results. Acupuncture, minimal clinical benefit, minimal risks though. I would love to try acupuncture for anything. I don't think there's any real harm in doing acu, and I think it's a great intervention for pain relief. Even though the research isn't for it yet, I still think you should give it a try. And then there are some biological agents that they've tried. All of them showed that they're really not that effective. Yes, for maybe rheumatoid arthritis or other immune-related things, but in terms of knee OA, there was really no change. So what I took away was in these types of treatments, aside from PT, chiropractic, those kinds of things, there really wasn't a lot of strong, moderate change. Maybe the only ones that really had any real good evidence was HA injections, the other injections that I can't say, and then this capsaicin cream, or heat as well. Moving on to PT and other types of things, we're going to see a lot, I think, quicker and better results, not only in the short term, but the long term. And I think that's where you should start first line. Doc, you want to move into that at all?
For sure. And some of this we'll get to the treatment, management of a lot of these arthritis conditions in a later segment, but specifically for OA, osteoarthritis, workspaces that we've touched on so many times will help significantly on that side of things. And even going back to the point that Doc made, there will be an image of everything he just talked about with this knee OA, even from this research article. So if you guys want to look at that, you'll have a general understanding of those specific ones that obviously we cannot talk about just due to censorship topics from there. But in terms of PT, you definitely want to look at not only a systemic approach to get blood flow to the whole body, whether that's any bits of cardio or just generalized easy full body movements, mixing in to your exercise week, targeted specific also other areas as well. But that comes in means of if you need a specific personal trainer, especially functional range conditioning specialist, I would suggest them. But outside that, we'll get some more things PT-wise and other stuff with that for osteoarthritis from there. So
perfect.
Common condition for most people, but again, it's something that if it's not necessarily always age, and then there is certain aspects of the osteoarthritis that you can reverse the symptoms to a certain extent, depending on your energy output and your dedication.
Yeah, perfect.
Doc, next one we have rheumatoid arthritis, or RA. Now, unlike osteoarthritis, which we just talked about, which comes from wear and tear, rheumatoid arthritis also occurs when there's immune system mistakenly attacks the synovium, which is pretty much the lining of the joints, which leads to persistent inflammation around there. So we usually see this in the hands, the fingers, the tips there, sometimes at the edge of the joints as well, sometimes in the neck. More times than not, there's a bunch of different ways that you can look at this. You would either want to check blood work, but you would also want imaging. Exams can help to a certain extent. But
there's usually what are called Herbert's nodes on the fingers. If you're wondering why you're getting these bumps on your fingers, if you're probably over the age of 55 is when these tend to start. I don't see them often in patients that are younger than that, but unfortunately, it can be genetic. See it a lot more in women than you do men, and it tends to attack the thumbs right away. Is usually a common area that you'll see it, and it can be very painful. But of course, when you're managing something like this, you got to look at the actual risk factors and causes. And if you're thinking about trying to improve yourself, if you have RA, you know that the immune system is a part of it. So how do you actually improve that part of it? Not so much maybe exercise or PT, not to say that doesn't help, but now there's something else underlying that you have to work on. Making sure you're cutting out the things that would cause an increase in inflammation: smoking, pollutants, poor diet, stress, these kinds of things. That's going to be first line of defense. And then I would say looking at gut health and trying to improve your diet, moving more, drinking water, staying hydrated, probably will be just as effective as, maybe even a little bit more effective than maybe like a PT or exercise routine. Not to say that, like I said, you can't throw that in there. You're still going to want to make sure you maintain good joint health as well. But this is something where I think you could start to bring in anti-inflammatories like fish oils and other things like that, where you'll see good change.
Yeah, especially turmeric, because remember, it's affecting the lining of the synovial joints, or it's usually the larger joints, but for this example, obviously, or for RA, it starts with some of the smaller joints in the fingers, thumb, obviously. So if you want to look at diagnostic testing, blood work, especially the anti-CCP antibodies, or the ESR, the CRP, that'll also give you a really good understanding. So if you need to see a physician, or if you want to know if you have rheumatoid arthritis, those would be the few things there. They can also check for elevated rheumatoid factor as well, which gives us a good insight. You mix that in with x-rays to see, and it's usually symmetrical, both sides of the hands that you usually notice it with as well. Interesting enough, I didn't remember this more, so I feel like I've learned this before, but in severe cases of RA, you can also have fever and weight loss. But I think
if it's really inflamed.
Which makes sense there. But and then long term, it can lead to deformities in the joints, which then can affect function and whatnot with that too. If you feel like this may be in your ballpark, or if you notice that you may have certain symptoms like that, if you haven't got it checked out, I would definitely suggest looking into that. But like Doc said, there's a lot of stuff. Creating a better foundation of your overall health can help with a lot of the symptoms on that side of things. But
Now, I know, Doc, we talked about this before the pod, but you talked about PEMF and some other frequency therapies. I love this stuff. I'm just curious what you have on it, and maybe I'll throw in my 2 cents.
Yeah, so we found some of the frequency-based therapies for RA and AS, or ankylosing spondylitis. And that's where PEMF comes into play. So pulsed electromagnetic field therapy. Now, if you want to go very specific for these types of conditions, you would want a frequency anywhere from 1 to 30 hertz, so a low frequency. And that will help for the inflammatory response. And also, we know from the past episodes we did on frequencies, that also helps for lymphatic drainage, also for, to a certain extent, energy, blood flow, helps with stiffness. So we know that side of things. Now, let's say for vibroacoustic therapy and whole body vibration. That's where if you stand on like a vibration platform at a frequency anywhere from 30 to 60 hertz, you go through, let's say, the workspaces or full range motion of any of the joints or regions of joints. That can help for circulation as well, improves blood flow, lymphatic drainage, all the stuff that I said there. And then the other interesting part was the binaural beats. This was interesting. Once they go into delta waves, which is 0.5 to 4 hertz, it helps for deep relaxation. And then the theta waves are anywhere from 4 to 8 hertz, which helps for stress. So all of these, you mix some of them in, can help for the re-regulation of the nervous system, which then can also help for the mobility, and even potentially on the immune side of things as well too, for the anti-inflammatory effect. But and even for some of these 15 to 30 minutes daily can help significantly for the symptoms. But it's interesting.
And some, it's tough because there are some machines out there that cost more than others, and it might be worth your time to find a provider who has, you know, a really good machine that you can get treatments by instead of having to purchase it yourself. I know one of the machines we use that I literally to this day is one of my favorite treatments on earth. I think it's like a $70,000 machine. So obviously not a lot of patients have the ability to purchase something like that for their home.
What was that one called again?
That was Pulse Centers, the brand, I believe, Pulse Centers.
Okay.
And the PEMF machine.
Gotcha.
And they have some different sizes and strengths, but the one we had was the big, it looked like, gosh, what did it look like? It was probably like this tall and maybe like this wide. And it was on wheels. And
3
you could,
feet high, a foot wide wheels.
Okay. And you had different attachments that you could put that redirected energy to certain areas. So we would put it around the shoulder, we would put it around the knee, the hip, the neck, the forehead, the eyes, and then we would do the paddles around the stomach or the liver or the prostate. And you know, these are other things you can focus with PEMF therapy. But specifically for pain, I loved it on my shoulder, my back, my knee. It was great. One of my most favorite ways to manage my pain. It was great.
Wow, fascinating. Yeah, I know you've brought that up many times before.
I need one. I need to make a quick 70K, and then we'll buy one for the clinic. Let's go.
Yeah, if anyone wants to donate, we're here for you.
That's awesome.
So going back to RA, so with some of this stuff, like there's different types of therapies, but that is something that's unique that is actually can be cost effective if you go to just even listening to some of the sounds. But I like what you said, a little bit more oomph behind it with the P. I would strongly suggest on that side. If you think that you may have, it usually is more common in females anywhere from 30 to 60 years old. Usually can come up with smoking, infections, even pollutants in the air as well. There is a genetic component with a family history for RA because of I think it's probably more on the precursor genetic cells there, but yeah. So next one we have psoriatic arthritis. Now, this is also an autoimmune disorder associated with psoriasis of the skin, which is like this flaky red patches of the skin. It can be in larger areas, can be actually quite uncomfortable, itchy, irritating, painful sometimes. So you add that in with joint inflammation, and that's where we get the psoriatic arthritis. Now, there's certain risk factors, especially genetic markers. HLA B27 is usually something that they test for, and this is one of a couple conditions that HLA B27 is also related to. That's just something to pay attention to. Now, this also affects mostly fingers, toes, knees, and lower back. And usually, like I said, accompanies with a skin condition as well with psoriasis. You can also notice either morning stiffness, these larger sausage-type digits, nail changes, like your fingernails or toenails from pitting, thickness, separation from like the bed of the belly, from when the nail comes out, fatigue, eye inflammation. So there's a few things on that, and yes, there's a genetic component as well, but usually when we see this, you definitely want to make sure that we get the symptoms of the skin under control, mainly because we don't know a cure. They usually go at the symptoms, so there's that, and then you add in some mobility work, some PT side of things, and that can help quite a bit.
One thing that you see a lot with psoriatic arthritis is large bone spurs that go off to the side of the vertebral body, and you'll usually see multiple levels of them. There are other inflammatory arthropathies that have that as well, so that's why If you have those, you'll want to do the HLA-B27 testing, make sure if it is positive, now you know it's more than likely probably psoriatic arthritis. And then the psoriasis is the other key. If you have psoriasis, that is something else you should think about looking into, is joint health, managing your joint, your back, if you are seeing that you have psoriasis on your skin too.
Really good points. That is, that's awesome. And then in terms of other, like lifestyle factors for this, and we're gonna get into a lot of this other stuff, a lot of it is creating that better, larger foundation, whether it's heat cold therapy, stress reduction, weight management, diet, anti-inflammatories, omega-3 turmeric, leafy greens can also help as well, acupuncture, CBD cream. So there's an array of different types of therapies that can help for psoriatic arthritis, but it's like we said, treating the symptoms.
I've found that in patients who have a lot of skin issues and pain, really taking apart their gut health. That's something that you'll see a lot of patients who have had acne, or if they've had other skin issues, and they really do a great job of fixing their diet and improving their gut health, and their skin conditions can subside. Versus going at it from maybe retinoid creams and a lot of the more harsher chemicals to try to manage, or like an immune suppressant drug, and really just trying to, and I understand it's very uncomfortable, I'm sure, to have those present if they're on your face and on your body, and it sucks to be in this digital world right now where everything is comparing itself, everything like that. But if you really want to do a great job long term of managing this without needing medications and other things, really looking long and hard at your diet and trying to figure that out, I think is going to make a big difference for you.
I love that. Yeah, it's something you don't hear that often, but it makes a lot of sense.
Yeah.
Especially for psoriatic arthritis. That's cool. So, like I said, we'll get into more other therapies in a hot sec here, but next one we want to touch on is gout.
Yeah.
Now, this is actually way more common. This is where you start noticing it's pretty much uric acid crystals which accumulate within the joints, which can cause either pain, swelling, can affect function. Some of the risk factors with this is if you have a higher diet in like high purines, or if you have kidney dysfunction, or if you drink a lot of alcohol or obese, those will also play a factor into it. But high purine foods, which you want to limit, are anywhere from red meats, beef, lamb, pork, sometimes seafoods, sardines, scallops, sometimes tuna. There's a whole list I'll put up on the screen.
Processed meats are a big one.
Yes.
Yeah, that's going to be the biggest one that you'll want to think about.
Yep.
Alcohol, like beer, that's another big one. And then a lot of fruit juices. Those are the big ones that I think most patients who have gout probably should avoid.
Yes.
They don't want to get flare-ups. Gout is really common in the toe.
Yeah.
So if you find one day randomly your toe is really red and swollen and you can't walk on it, good chance you might have gout. I would go get it assessed and look into this kind of management for more of a long-term reduction.
And sometimes it happens in the knee, and I've actually just had a case of wanting to get a second opinion for the hand. I've noticed it in too. So you can diagnose on x-rays, but it's usually MRIs usually work well too. There's a couple different ways on that side, but in terms of better choices, again, low purine foods, we'll have that up on the screen. That's chicken, turkey, eggs, low-fat milk, yogurt, cheese, whole grains in terms of brown rice, oats, whole wheat, bananas, apples, berries, carrots, bell peppers, cucumbers, olive oil, avocado, almonds, walnuts. So there's a few things with that. And then there's another one we'll get to here after a bit, tart cherry juice as well, which there's some actually cool research
I'm interested
behind
to hear
as well.
about that. I really am.
Yeah. So now, ankylosing spondylitis. Now, this is an interesting condition, and usually it starts with chronic like lower back stiffness and then works its way up from usually the SI joints up from there. It's usually the pain that improves with movement, but it's worse with rest.
18-year-old male.
Yeah.
That'll be the time you get diagnosed. It's in that 18 to 25-year-old kind of range, and it's very common in men.
Yes. I love that you brought that up. And this is also one that's also linked to the genetic component of HLA-B27 gene as well. So if we need to get blood work there, that's a reason on that side. The biggest concern with this one long-term is it forces fusion of the spine specifically, or the joints, which can pretty much force lack of movement on areas either above or below. And that's where, for some individuals that try to force movement, even though they're not able to, can get certain fractures, spinal fractures. Yeah, their physical therapy and trying to maintain mobility is so important for these individuals. Also, on the same time, that the nutrition side of things, supplementation, anti-inflammatory diet also helps significantly as well. But yeah, you want to maintain mobility long term.
I know a lot of patients who really have really bad cases will try to get this kind of immune suppressant drugs to try to stop the immune system from doing this, and it sucks. It sucks that you have to rely on that, but it can be helpful. I think you should also pair it with, though, good movement, diet, other things to support the system, other than just relying on the immunosuppressant drug.
100%.
Yep.
And there's more specifics with that. We'll put some of that on the screen as well as we go through. But we just want to touch on the gist so you guys have a general understanding. If you feel like some of this may be added up to what you may be experiencing, that you'd ideally want to see a physician to make sure everything's diagnosed properly as well, so you know the right path to go on. Now, the next one is interesting, arthritis in younger individuals, so juvenile arthritis, or JA. This is also related to an autoimmune disorder affecting children, which affects the joint inflammation, most commonly under 16 years old, and affects girls or females more. It's part genetic component, but also affected via environmental triggers as well, whether it's food, whether it's the diet, like we said, a lack of movement, like there's a few things with that.
Yeah, if you feel like your kid is having, and kids shouldn't really have a lot of pain. We're seeing it more now, unfortunately, because of more sedentary lifestyle with tablets and digital, and also kids are starting to become more obese quicker in life, and we're just seeing a lot of these issues. But if you see that your kid has abnormal swelling in the joint, that'd be a first sign of getting this assessed. And then secondly, if they're just more sore in between the ages of like 6 to 15. Now, if they're starting to play varsity sports at that 14, 15, 16 age, you're going to probably have some soreness. But below that, you start having a lot of swelling and pain, I would want to get this assessed right away. I had a friend who had JA, and his knees would swell immensely, and they'd have to drain them. And he'd have many milliliters of drainage multiple times during the year. And that drainage, if it didn't happen, really can cause a lot of other issues in the short term. So you don't want to get sepsis and other things, especially in the kids. Yeah, please get that looked at. If you find it's just out of the ordinary and you feel like your kid is more sore than other kids, and just look into that, because that's something you want to start managing as soon as possible.
Really good point. I'm really glad you brought that up. Now let's dive into, I guess, like septic arthritis then.
Yeah.
Okay. So whether that's the cause of bacterial, viral, or even fungal infection in a joint, it's actually more common in older adults. Also, infants or people with a weakened immune system. Usually, like you said, comes with joint surgeries, diabetes, or even existing joint conditions. So
I saw a patient with septic arthritis. He was over 400 pounds, and his knees were so incredibly swollen. And a provider decided to do an injection in his knees. I'm sure he was very much a diabetic. He had swelling and inflammation in this joint, and they did a cortisone shot in it, and that knee looked awful, ugly, and it looked like someone took a chisel and just whacked it as hard as they could, and there was just this big black hole just sitting there.
Wow.
And I told him he needs to go get that looked at, because I believe he's got an infection. And he ended up going, it went sepsis, and he almost died because someone decided to inject a swollen joint. And that's one of the most common sense things of not to do, is put a needle in a swollen, inflamed, and edemic joint.
Yes.
So, yeah.
Oh, good Lord.
If you have a lot of swelling in a joint, I wouldn't recommend someone put a needle in it unless they're looking to either withdraw fluid or if they know what they're doing. But just my 2 cents.
So true. Now, reactive arthritis, next one. Usually develops after infections. It could be whether it's food poisoning, STIs, like chlamydia would
Yep.
be another thing. Usually more common in younger adults with history of infections. This also has a genetic component also related to the HLA-B27 gene as well.
Not as common.
Definitely not. I haven't seen any cases myself there. And then one of the other arthritis is lupus, or lupus-related joint pain, which lupus is an autoimmune disease which affects the immune system and how it can attack certain joints and other
Yep.
organs. This is usually most common in females, like up to 90%, diagnosed anywhere from 15 to 45 years old, and of course there's a genetic component as well. We had an individual came in for, it was referred by another patient, but full systemic joint pain throughout, swelling, redness, and we just referred her out. There was something going on that wasn't really in our ballpark. I don't think we would be able to help out the best we can, but yeah, it's interesting.
And she had SLE.
I think they were going to check that out.
For lupus,
I don't
yeah.
think she had any clue even what lupus was.
Yeah.
So I think we send her in the right pathway to hope she can find that diagnosis. But
for sure.
Doc, have you worked with any lupus patients?
I've worked with a few lupus patients. Okay. It's unfortunate. It's a progressive, chronic progressive disease, and it's a time clock for a lot of these patients, which is unfortunate. Not only does it attack the joints, but the organs. I think a pretty common presentation you'll find is kidney damage is a really common organ that it attacks, among other ones. I know Selena Gomez, who's a famous celebrity, has lupus, and I think she's already had multiple organ replacements.
Wow,
Kidney is one of them. I'm not sure what other ones she's had, but yeah, it's miserable, and it's not easy to manage, especially if it's just a severe case of it. So it is. It's rough. So if you have the SLE diagnosis, just know, continue to protect the joints that you have, move. You know, sometimes it's not a matter of if and when in those cases, but I know a lot of patients who have had SLE that get on a what's called a low lectin diet. That's been helpful for them, especially if there's an autoimmune component to it. That's a book by Dr. Stephen Gundry. Dr. Stephen Gundry is his name. He's a cardiothoracic surgeon that turned into a functional medicine provider, and he was ANA positive. He had an autoimmune blood marker that was positive and had a lot of issues, and found and studied this low lectin diet, and it reverses a lot of the patients that have ANA titers to 0.
Wow.
Now, it's a very difficult diet, but can be helpful for those who have autoimmune issues, especially lupus. He sees a lot of lupus patients.
Oh, thank you for that feedback. I feel like I've heard that before, but interesting.
Interesting guy, interesting diet. But
lovely.
grain of salt.
Love that. Shoo.
Yep.
All right, so Doc, let's get into some of the treatments, because I know everyone's dying to hear what are specific things outside of what we already touched on.
Yes.
That has some evidence-based research behind it. What have you found thus far with that?
So if we are going to treat and manage arthritis the best we absolutely can, here are some of the, we'll call them more evidence-based or backed by research ways to improve arthritis. And some of these are probably better than others in certain cases. Don't just hear this and start it. I recommend you get a provider to help you with a lot of these things. But exercise was the #1 thing that they recommended. Resistance training improves muscle support around joints, reducing pain and disability. Aerobic exercise, walking, cycling, swimming, reduces inflammation, improves mobility. Those are going to be used in almost every condition on this earth. You just, exercise will help you no matter what. The next was weight loss. So in certain cases, weight loss can absolutely reduce. A weight loss of at least 5 to 10% showed significant reduction in knee osteoarthritis pain and can slow progression. Next was fish oil consumption. That has shown to reduce inflammation by lowering certain inflammatory markers, which can help with arthritis. Next, a Mediterranean diet rich in polyphenols, healthy fats, and antioxidants can actually reduce systemic inflammation in both RA and OA. And that was a study in 2003, which helped a lot of patients with their pain management.
Beautiful. Wow.
Curcumin reduced arthritis and pain inflammation comparable to NSAIDs in certain studies, and it showed that it actually did better in certain studies. And this was about 500 to 1,000 milligrams a day. if you want to do curcumin. I like curcumin. I like to use it in place of NSAIDs sometimes.
Yes.
I think it has a better side effect profile. Really isn't much you have to worry about using curcumin. And it is helpful for pain and inflammation. It does take some time for it to set in, maybe a few days, versus NSAIDs can be more quick, but I would recommend you switch to that if you have been on NSAIDs long term.
Love it.
Glucosamine and chondroitin. These are supplements that you can take that can slow cartilage degradation and improve symptoms, particularly in knee OA. That was a study out of 2011. Low vitamin D levels are linked to increased arthritis severity. This was in 2013. Supplementation of vitamin D and calcium may help in OA and RA patients.
Usually vitamin D and K2 work well together.
Yes.
So synergistic.
Yes. I always like K2 with my vitamin D. Great point.
Love it.
Green tea polyphenols.
Interesting.
So this is abbreviated EGCG, which is epigallocatechin gallate, which is found in these green tea extracts, reduces inflammatory markers in RA by inhibiting this certain inflammatory pathway. If you've tried a few other things and you want to try this instead, give it a try. I would choose maybe curcumin first, or maybe a fish oil, even vitamin D. But this was just one thing that I had recommended. Collagen peptides, which it's funny, I did a really big dive into collagen peptides the other day because my significant other wanted to know more about the skin improvements.
Yes.
So I found that collagen doesn't really help with anything in the skin. It's so mixed with research. It is. They say that there's really no point in taking it. There's so many other ways to improve your skin. Now, in terms of pain, though, and joint pain and function, it does have somewhat decent backing. Collagen hydrolysate is the compound that you'll look for, making sure that's the form you need to look for. But it can improve in joint pain and function, particularly in OA. This is a study out of 2008.
Cool.
For skin, though, I think you're wasting your money, from what I found.
Okay, interesting.
But it was interesting.
Cool.
Capsaicin cream, we've talked about. That can reduce pain. It actually depletes what's called substance P, which can upregulate our pain receptors.
Yes.
Acupuncture, this actually showed for certain things it can be effective. This one was knee OA pain relief for function and improvement via endorphin release. PT, targeted PT programs, that's going to be one that we recommend all day long. Improves mobility, reduces stiffness, prevents joint degradation. HA injections, again, we talked about. Tai Chi and yoga is super helpful. Probiotics and gut health for certain arthritises, we talked about, that can contribute to issues. Sleep optimization, that's how we heal, improving our sleep. Red light laser therapy or low-level light laser therapy, that can reduce pain and inflammation. I think that's an amazing one to do on all patients with arthritis. Anytime we do it on a patient, it's incredible. That thing is humming back there. Cold and heat therapy can be good in the short term, sometimes the long term.
Yeah, so I would say for more, especially heat-cold therapy, heat usually works better for more forms of arthritis. Unless there's swelling, redness around the joint, then you would not want to go heat on that side. Maybe ice for the numbing component, swelling component, but be cautious on that for sure.
So Doc, save the best for last because I am really curious of tart cherry juice, but I know there's a great amount of research on a lot of cases of arthritis with this. So you want to just touch on all of those?
Oh, absolutely. So I'm going to, let's go into the tart cherry juice. And then there's one thing I want to touch on with some of the physical therapy PT side that can help a lot with most people. But let's get into this tart cherry juice. I know we've learned this earlier on in school to where it can help for different forms of arthritis. In fact, there's 5 different case studies that are actually pretty decent that went into this. For this, the tart cherry juice helps for the pain and inflammation markers. The first one was the efficiency of tart cherry juice to reduce inflammation biomarkers in osteoarthritis. Now, this was a study, it was Journal of Food Studies in 2012. It was a double-blinded, placebo-controlled study.
And this, by the way, is
that's good.
One of the highest study qualities you can have. A double-blind and placebo-controlled. So this is great to see.
I love that. And this was about 20 women, ages 40 to 70 years old, with inflammatory osteoarthritis. The participants consumed 10.5 ounces of tart cherry juice twice a day for 21 days, and they noticed significant reductions in almost all the inflammatory biomarkers and also C-reactive protein levels, so the inflammatory markers throughout the whole body.
Excellent.
From there. So usually when I talk to people about tart cherry juice, I usually say drink about 10 ounces or so, maybe a couple hours before bed, and then in the morning when waking up.
So that's your twice a day then?
Yeah.
Okay, gotcha.
That, or if it's tougher for them either at night or they forget at lunch, is fine too. But
how soon do
know
you
there.
see changes in patients who are trying to get pain relief or and manage certain things?
It's actually relatively quicker. I usually would say for most people anywhere upwards of the first week,
Okay.
2 weeks or so, they should start noticing differences there. Then the next one, if that didn't sway you, there's a randomized study for this knee arthritis for tart cherry juice. And this was out of the journal Osteoarthritis and Cartilage in 2013. They took 58 patients with knee arthritis and participated in another double-blinded, placebo-controlled crossover trial. So it was daily consumption of tart cherry juice blend for 6 weeks, and they noticed a huge reduction in pain relief versus the control. There's that as well.
Yep.
And then even with some of these other ones, tart cherry juice for uric acid in gout patients, a study of 2020 showed reduction in uric acid levels as well, potential and also really good anti-inflammatory effects there. And then there's a systemic review for tart cherry and inflammatory markers. This was a study at 2022, which is another RCT or randomized controlled trial. They noticed that lower C-reactive protein and also tumor necrosis factor alpha or TNF alpha, both also linked to arthritis, also lowered as well. So
nice.
Helps on that side. And then also pain reduction after 8 days for a long distance race, which also help for muscle pain and recovery as well for soreness on that side, especially for arthritis patients.
So if you're going to do cherry juice, do it every day, twice a day,
Yep.
and about 10 ounces per dose.
Yep.
See.
And I would probably, much the same with every type of supplement. Ideally, you'd almost want on a little bit of a cycle, maybe every single day for a good 6 to 8 weeks. Take a week off and then start up again, so you kind of offload as well.
Yeah, there's been some good studies showing it's good to cycle like that.
Yes. Now, going back to some of the PT for osteoarthritis, I know we touched on workspaces, so going through the fullest range of motion through every single joint, even if it's at fingers or side to side, forward and backwards, adduction, abduction, so all that will help significantly as well. But even isometric contraction, so anytime you get to area of stiffness, sharp pain-free specifically, you would then want to apply an isometric contraction. So for example, and this would be how you can open up ranges of motion quite well, and it also helps for instability, but that's a whole nother thing in itself. So let's say we have osteoarthritis in our lower back. The disc is breaking down quite a bit. We want to get the fullest range of motion possible, so we're going to look to do lumbar workspace or the biggest motion possible. If we notice any areas of stiffness, or if I bend forward, I notice there's a lot of tension, tightness, and I maybe can't touch my toes, then I would want to apply a muscle contraction. So squeezing my core as I'm bending down, or vice versa. We go into a cat, camel, or a upwards dog pose, if we will, and then squeezing your core, same thing. So you're applying a contraction at a local level as everything's lengthened. So that can help for more blood flow, not only locally at a deeper level, but also for overlying muscle tightness, tension, which then helps for mobility. So you want to vary from mobility practices to strength training to full systemic, full body movements, but then also target specific other structures, especially that have arthritis, with isometric contractions of certain. So it's pretty much you're squeezing the nearby muscles near whatever joint you have arthritis in, and you vary the intensity, like you squeeze those muscles as hard as you possibly can at 100%, or you vary it anywhere from 50 to 75% intensity. So
just to and then work your way up.
yes,
Yep.
yep. And consistency is the biggest thing that it will help there. That way you can look at not only this whole systemic body and approach that way, but also you can be very specific. But that usually comes in lines of a practitioner that can be very specific to what arthritis you have, and that can also look if they need to incorporate any like anti-inflammatory or nutritious diet implications into it. Hugely
It's going to make a bigger effect.
Oh, hugely.
Yep.
All right, Doc. Now, let's get into a fun interactive game, myth or fact on arthritis.
Yep.
Let's start here. Cold weather makes arthritis worse.
So this is funny because I was just on a board talking about this the other day, and there was a gentleman who shared a study basically disproving, we'll call it, that that barometric pressure or even coldness can make arthritis worse or have differences in pain. But then there was another gentleman that went and shared an exact opposite finding in a study. And so you'll find this with any real condition or treatment is there's going to be studies showing one thing, there's going to be studies showing another thing. How do you take this research and actually clinically apply it? What I know is I've had many patients tell me that cold kicks their butt.
Oh, and it's weather fronts that come in.
And
so many patients.
Whether you give me a body of research that says yes and then no, and then it's mixed and you don't really know, I'm going to take what I've experienced clinically.
Yes.
And I absolutely have seen that patients become worse when there's a cold front and they're not used to it, and it can be miserable for them. And
not all, but
not all, but a good amount that, especially that have arthritis. So I am going to call that a fact.
I would, you're definitely right on that one. Yep. And that usually comes from the joints and the pressure in the joints, which then those are the first signalers, and then it gets to the tissues. So whatever study they're probably looking at, I would probably be on the method side of things based on how they did the research, and my guess would be from there. But it's so many, and that's another reason why, as like a physician, I look at the weather not for just temperature-wise, but I see the changes of low fronts, high fronts coming in, so you can almost start either prepping patients. In the next couple of days, you might be I feel achy tension, especially if they've noticed in the past.
Even the other day, last week, or was it last week or 2 weeks ago? It was a little colder. It was raining. It actually rained in Arizona. And I had a lot of my patients. One of them came in. I and asked, "How are you doing today?" He goes, "Oh, I'm a lot worse." And I was like, "Oh, what changed?" He goes, "Oh, it was the weather." But he had been perfectly fine for many months, and that was just something that he's like, "Oh, it's this. This is what really gives me grief." And so, I thoroughly believe it. I thoroughly believe that it makes a difference.
Now, I started messing around with changing the core body temperature. So like when it starts getting colder, I started having patients put running warm water over their hands or a warm cloth, warm cloth over their forehead, and actually helps reduce the symptoms systemically wise. So there might be something partially related to the temperature in relationship to the barometric pressure. Just
good to note, though. You could try.
Stay
warmer. Try to stay warmer.
Yeah. So something to plan out there. But all right, Doc, let's see here. Cracking your knuckles causes arthritis.
It does not. And what's cool, there was a gentleman that won a Nobel Prize for dismissing this. So he, for 61 years, only cracked one of his hands.
Okay.
And had MRI and X-ray studies throughout his entire life, and found absolutely zero change in difference between the progression of arthritis or change in his hands, one versus the other. And he won a Nobel Prize for that.
That's cool.
Yeah.
Fascinating. Yeah, a lot of it is just gas releasing from a joint. I feel like unless you pop it or release the gas in a different way that can jam the joint, then I could potentially see potential effects, but like long axis traction or lengthening of the joint, like if those are not watching, if you pull your finger and you might feel a release, that is different from then putting pressure backwards to get the release. So
I don't think it would ever have any issue.
I still don't think so either, but there's that. Now, exercise can actually help arthritis pain.
Agreed.
That's pretty self-explanatory there. I know we touched on Tart cherry juice. Arthritis only affects older adults.
And I would say no, not all the time.
And if you've been listening, juvenile arthritis, we've touched on that already as
Yep.
well. The arthritis, it's going to be one of those to where I would go back through, but there's a lot of specific tools that can help. I know we touched on a bunch of those already. Now, there's a couple of fun challenges / tests that you can go into. We almost would call it Arthritis Olympics. Be a weird way to call it, but yeah. And this would be like if you have probably more severe osteoarthritis, moving sharp, pain-free, ideally through this whole process. But the first challenge would be the one-leg balance test or one-leg balance challenge, where you stand on one leg as long as you possibly can.
I love that one. I give that to so many patients.
Let's go. And then I know you vary it up in terms of eyes closed, eyes open,
Yep.
a different support system.
Yep. If we want to work more proprioception, you can do eyes closed, work them on a foam pad, unstable surface. But that actually is a longevity test. They've showed that those that can stand on one leg for longer than 10 seconds has a higher chance of living longer, less mortality rate.
Eyes closed, eyes open, does that?
Just eyes open.
Wow.
Yep.
Okay.
Yep. And it's a good predictor of fall risk, so many different things, if you obviously can't do it. So that's going to be one where if you aren't passing that with flying colors, you should be looking to work those stabilizing tissues, getting stronger, lifting weights, and working on that challenge.
Love it. Challenge your friends.
Yep.
And or family members. If you feel like unsafe, unsteady, maybe stand closer to a wall.
Yep.
And then try it. There's no excuses. Give her a go.
Yep.
Now, the next one, the chair stand test. Now, this is where you sit and stand from a chair as many times as possible in 30 seconds.
Nice.
I actually really like this one, especially for the older individuals, because one, it trains type 2 muscle fibers, so you get more speed. It will help for fall risks. It'll also allow you to get into a squat formation with less problems of injuries, especially from falling backwards or in the knees, lower back.
Dr. Clary in Minnesota, he gives this as a first exercise to every new patient he sees.
Oh, I love that.
And it's
cool.
How many times can you actually sit and stand from a chair all day? He says, if you're doing 100, I don't care. That's perfect. And some of these patients, he said, are in their 70s, their 80s. And he goes, if you don't get to 100, go to 10. And then go to 12, go to 15. And he goes, they've never, ever been pushed the way that I try to push them because everyone's so afraid of harming them or hurting them. But he goes, you'd be surprised at this one exercise that I try to get them to do every day and how much more mobile and confident and happy. And they start doing that for 6 weeks. He goes, I got patients that are jumping down and up off my table that they had never even had the ability to do before that.
Wow.
And that's one very simple thing you could just try. I loved it.
Ooh, let's put a star on the chair stand test. Oh, dude, I love that. Okay, so the next one would be the arthritis-friendly dance-off. Now, I look at this for anyone that feels like they like to dance for fun or just enjoy time with their loved ones and the friends and family surrounding them. It's put us on, dance gently or as best as you possibly can for 2 to 5 minutes. It's a fun way to get movement, circulation, ease of stiffness, and then send a video clip, send this challenge to another friend, family. It's like a dance off.
Yeah.
Be fun that way. Another one, the finger flexibility challenge. This is where you try to touch your thumb to each fingertip and then stretch your hands as wide as you possibly can from each finger opening and closing. This helps a lot for dexterity.
So definitely like RA patients, those that are having issues with the hand, good thing to try.
Yep, I know we have this kind of built into our clinic and rehab base as well for those type of patients as well, yeah. And then another good one, which is a very cost-effective way which can help for grip strength, is the water bottle hand squeeze test. So you squeeze a half-filled water bottle for 10 seconds, switch hands, and you go back and forth. You gradually increase the repetitions over a period of time.
Yep.
Build up the grip strength from there.
And we know how much grip strength can be used as an indicator of health and longevity as we get older. It's great for independence too, when we can maintain grip strength as we age.
I really like the chair stand test.
Yeah.
I might have to start implementing that way more.
I love it.
That's
I've used it
amazing.
on a lot of patients that aren't, willing to do 5 to 10 exercises a day. So I'm like, all right, this is the one, man. You got to do it.
That's perfect.
How many times can you stand up and sit down? And that's it. And it does a great job of keeping it simple for them, but it focuses on so many good tissues and pushing them versus just having them stretch. Let's push you. Let's actually get you some change and response.
Yeah, you got to activate the tissues.
Yes. Everybody, thank you so much for watching. We appreciate each and every single one of you. Seriously, it's been surreal to see this podcast grow over the year, or this last year, and we're only looking to go up from here. So please, can you like, share, subscribe, everything? It does make a difference for us. If there's anything you guys want us to talk about, please comment in the comment section and give us some ideas. We're absolutely excited to break down anything you guys want to learn more about, and this is something that we really enjoy. So until next time, guys, until always, have yourselves a good day.
Disclaimer, the content provided in this health podcast is for informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Reliance on any information provided in this podcast is solely at your own risk. The creators and hosts of this podcast are not responsible for any actions or decisions you may take based on the information presented.
Thanks for joining us on The Functional Code. For more evidence-based health insights, subscribe, rate and review wherever you get your podcasts. Remember, your journey to a healthier you begins with understanding the Functional Code. Until next time, stay well, stay informed, and embrace the science of living well.